We are here to discuss one of my top priorities, and that's caring for the veterans who are suffering from toxic exposures. Sometimes service members are exposed to dangers not just from the enemy, but from the air they breathe, the water they drink, and the ground they walk on. For generations, veterans have struggled getting benefits and services from VA for those sorts of toxic exposures. Their stories are heartbreaking. On several occasions, Congress has stepped in to ensure that they get the care and compensation that they are due. We did that most recently with Blue Water Navy veterans from Vietnam, after they waited decades for the benefits they deserved. Today, we will discuss several legislative proposals that would create a pathway to care and benefits so future generations of toxic exposed veterans don't have to wait that long. Too often, toxic exposed veterans are denied care and benefits because there is not enough science to determine whether their condition is linked to their time in uniform. Establishing that connection could take years. Some veterans don't have that long. We need to help and help now. We must find a way to support them while VA and the scientific community continue to do their research. To that end, some of the bills we will discuss would establish new or amend existing presumptions of exposures. That would ease the burden on toxic exposed veterans to provide to prove that their disability was caused by their service in order to receive benefits. Other bills would expand access to VA care for toxic exposed veterans. My bill, HR 2127, the TEAM Act, would do both. It would create a consistent process within the VA for establishing presumption of exposures. It would also allow toxic exposed veterans to enroll in the VA healthcare system. There are other bills on the agenda introduced by Republican colleagues, including Damage Subcommittee Ranking Member Nails, Representative Zeldin, and Representative Westerman. And I'm grateful to them for being leaders on this important issue and working to improve the lives of veterans and their families. I'm eager to learn more about their proposals and those of our other colleagues. That said, all of them come with a heavy price tag. I look forward to working with my colleagues and the VSOs to find offsets for them. I'm disappointed that the VA did not provide cost estimates or written views on several bills. I appreciate VA's efforts to review how the department cares for toxic exposure veterans, but now is the time for action, not more talk. I hope VA is prepared to provide views and cost estimates verbally today. Finally, I would like to recognize and extend my condolences to the minority witness, Mr. James Price, whose wife, Lauren, recently passed. Mr. and Mrs. Price are longtime constituents of Representative Bilirakis, who is also here with us today. Lauren was dedicated to helping toxic exposed veterans. She was one of them. She knew as well as anyone about the sickness and suffering that toxic exposure can cause. Lauren was a co-director of Veteran Warriors. She was a determined and fierce advocate. She will be missed. Her legacy lives on through her family and her contribution to her fellow veterans. Jim is here to speak on Lauren's experience with toxic exposures, as well as his own. Jim, thank you for being here. There are countless veterans and families like yours who are waiting for help. Know that I'm committed to making sure that you don't have to wait much longer. And I know that many of the members on this committee are in that same thought process of trying to move through this process as fast as we can. With that, Mr. Chairman, I yield back.
Thank you, Ranking Member Bost. I really look forward to engaging with you and the minority on this topic. I think we're on the precipice of doing a really, really important thing for America's veterans. So we will now continue with our first panel, where we'll hear from others who have sponsored legislation on today's agenda. We'll first hear from members of this committee, and then we're going to hear from 8 of our House colleagues. Each member will have 3 minutes to provide comments. Ranking Member Bost, you're recognized for 3 minutes to present your bill.
Thank you, Mr. Chairman. I appreciate you including my legislation, H.R. 2127, the Toxic Exposure in the American Military, or TEAM Act, on today's agenda. We're here today because veterans and their advocates have told us time and time again the VA is falling short of its mission to care for toxic exposed veterans. When I was ranking member of DAMA committee, I heard from veterans exposed to burn pits about their struggles enrolling in VA's healthcare system and getting a service-connected rating for their disability. Why? Well, because the available science did not yet support their presumption. These veterans were afraid that they would have to wait decades, like veterans of prior conflicts, for the science to catch up with them. They were afraid it would be too late. And they were frustrated by the lack of transparency from VA about decisions to expand presumptions that many allowed toxic exposure veterans to receive care and compensation. I heard their concerns and I share them. We need a system that works for the veterans today and tomorrow. The TEAM Act would create that system. My bill is the result of months of discussions with members of Congress, VA, veterans and military service organizations, particularly those in the TEAM Coalition and others. The TEAM Act would create a regulatory framework that VA must follow for establishing presumptions of service connection related to toxic exposures. VA would also be required to publish presumptive determinations in the Federal Register. Such publications would ensure that veterans and the public can review and comment on the reasons for VA's decisions. Critically, the TEAM Act would allow toxic exposure veterans to enroll in the VA healthcare system. That would ensure that nothing stands between the veterans who are sick and the care that could save their lives. The TEAM Act would also advance research into the health and effects of toxic exposures by authorizing the National Academies of Science reports and establishing toxic exposure commissions. Finally, the TEAM Act would mandate outreach to the veterans and survivors and improve training for the VA staff. My bill would provide current and future generations of toxic exposed veterans with the assurance that they will be taken care of and will have a place to turn for help. I welcome feedback on the TEAM Act. I would like to thank the 30 organizations within the TEAM Coalition that helped to draft this bill and who support it.